Hello, everyone. I'm Jim Garrison. I want to welcome you to this session of Humanity Rising as we explore the mysterious healing powers of the ear. I want to let people know sort of procedurally today, tomorrow, and Friday, we're going to have abbreviated sessions of about 45 minutes or so, because as many of you know, there's a big course with Bertie Jaworski on remote viewing with a specific intent to establish communication with extraterrestrials. And I know a lot of you have signed up. I'm going to be attending the course as well. So we'll have about 45-minute sessions over the next 3 days. And then we'll adjourn to the after chat. And that can go for as long as everyone wants. So thank you. I want to now introduce Duvan Hoffmann, who is the founder of integrateauricular.com. He's one of the world's foremost pioneers and explorers in the mysteries of the ear. We often think of the eye as a portal to the brain, but so is the ear. And he's going to tell us all about it. So, Duvan, I want to welcome you to Humanity Rising, and I turn the program over to you. After Duvan's presentation, I'll circle back in for brief dialogue for the balance of the time. Thanks so much.
Okay, Jim, thank you for the introduction. I would probably see it a little bit more modestly. My role is director at Integrate Auricular. Yes, it is a platform that I've founded. It is the result of my work with the Canadian Institute of Auricular Medicine and auricular medicine doctors and trainers worldwide. So auricular medicine is part of a larger field, which is related to auricular acupuncture, auriculotherapy, and ear acupuncture. Auricular comes from the auricle, and the auricle is this outer part of our ear. That's the auricle. And on the outer part of our ear, we have a microsystem. And this is what Jim was referring to, that, we know that the eyes could be a window to the brain. And the way that I would see that is that the eyes, in a way, are a microsystem as well. Just as the hands are a microsystem, the feet from foot reflexology, the scalp, etc. So the ears are a microsystem, and today I want to talk about the outer ear, the auricle, as a window to your brain. And with training, you can use this window to gain rapid insights for assessment and treatment of complex health conditions. And I want to discuss so that you can discover the somatotopic organization on your ear. So there are numerous neural reflex zones, and the World Health Organization has actually, or does, recognize the ear as being one of the microsystems on our body that contains the most densely populated collection of neural reflex zones. So I want to share my screen. Give me one moment. And let's see if this works. So maybe we'll start with at the Stone Age. Doctors in auricular medicine, Dr. Dorfa and Dr. Barr, they have published a paper, a medical report from the Stone Age. But the Ötzi, which is one of the icemen that was found in Tyrol about 5,000 years ago, had tattoos, and other icemen found around the world have similar tattoos. And There are many articles you can find online where you can see that there are burn marks on these bodies that were perhaps not just tattoos, because there were tattoos that had aesthetic value, but that these burn marks, these cauterizations, actually weren't of aesthetic value, but they seem to line up with acupuncture points and meridians. So these are some of the images from that. Dr. Paul Nogier, a French doctor and a physician working in the 50s and 60s, he was born in 1908 and lived until 1996, but in the late 50s, he basically developed auriculotherapy. And Paul Nogier's finding of this leads us to somatotopic organization. So what Paul Nogier found was that the ear is almost the shape of an inverted fetus. And this inverted fetus is with the head at the lobe of the ear and then curled around the helix of the ear. So here in this little ear, you can see that there is an organization that follows nerves to function. So the hand is reflected very large because we have a lot of nerves in our hand, whereby the knee or the leg is very small because we don't have that many nerves, certainly not as much as we have in our head. And that's the large part of our ear, which is on the lobe. So this somatotopic organization gets very, very specific. And we can look at, we can see examples of this here in the reflex zones and structures of the vertebral column. So if we look on the ear, actually, and this is only one aspect of the reflex zones, but here is our C0, C-spine, starting at the neck, where our head sits on, and that on our spine goes the entire part of this anti-helix all the way to the end to the coccyx, which is underneath here, and the lumbar spine. And we can find here the zone of the paravertebral muscles and ligaments. We can find the zone of the vertebra, which is here, this blue line. And we can even go down to the sympathetic trunk. And these are the nerves at the trunk of the spine that have been branching out for the rest of the nervous system. So our ability for neuromodulation, or to stimulate very specific aspects of our physiology, are very precise. And so then we go from Paul Nogier there are important people like Mutulu Shakur. Mutulu Shakur is actually the stepfather, I believe, of Tupac Shakur. And Mutulu Shakur, he was part of or associated with the Black Panther movement. And you can go online to Integrate Auricular and watch experts on the history of this, as shown by Iana Meng, who produced a very great documentary on Black revolutionaries and acupuncture. But the reason I'm talking about Mutulu Shakur is that he, at a time when the community that he was involved with in the Bronx was suffering from severe drug addiction, he took over a hospital in the Bronx, and together with the Black Panthers, they took the hospital in order to provide medicine the way that they believed that it could be provided, in order to deal with the drug addiction problem. The authorities had a tough time getting them out of the hospital. At some point, Mutulu Shakur unfortunately did end up in jail, but he played a major role in bringing acupuncture from the East to the West. And it is a history that is unfortunately lost. In Hong Kong, there was a neurosurgeon who was using 5 specific points in order to treat addiction. He saw that with 5 specific points, addictive behaviors could be regulated or reduced. And Mutulu Shakur developed a 5-point protocol for auricular stimulation in order to do that, just that. And this 5-point protocol became what is now known as the National Acupuncture Detoxification Association Protocol. That's the NADA protocol. And the NADA protocol is now being taught worldwide and is a protocol that is found in many health centers and addiction centers and mental health centers in order to help people regulate addictive behavior. Let me see how I can stop my share. Okay.
It was stopped.
Oh, it was stopped. Okay, great. I kind of need to see somebody because I feel like I'm just talking into space and it's very difficult for me.
Where did you go? You turned off your
Oh, okay.
video here.
There we go. There we go. Sorry about that. I lost you for a second. So the NADA protocol is being used internationally in order to treat addiction. So the ear, we can, now we know that our body is reflected on our ear. We can use the ear to find specific points. Now, when the ear, if you took a very precise pointer, Jim, for you, let's just say a golf tee, because we don't want to start with needles. But you could use something as a golf tee and press on your ear. And you may find that a certain point is far more tender than another point.
Yeah.
When you hit a tender point, what you're hitting is actually a nerve. And what makes the ear so interesting as a microsystem is that the ear is innervated by all major nerve branches or nerve bundles. They innervate the ear. So through the ear, we can access all the major nerve branches.
And all the acupuncture points are in the ear as well, right?
In fact, because of that somatotopic organization that I was talking about, in fact, auricular medicine doctors have mapped the entire meridian systems on the ear as well. So everything neurological, that is everything of our physiology and our mental well-being, is mapped on the ear. So the brain is taking a mapping of the body, that's nerves to function, and reflecting it on the ear because of this innervation pattern. So this means that we can use
Now, the
the ear.
innervation, explain what innervation pattern means.
Oh, innervation means the nerves that are innervating, right, the skin, or that portion of so our nerves go everywhere into organs and things, and the organ of the ear is innervated by the vagus nerve, by the trigeminal nerve, and by the cervical plexus, etc. Major nerve branches are going into the ear. And I guess, that's part of what I was showing here with this innervation. If we go, we can see here innervation, and here we can see three major areas on the ear. So this is the great auricular nerve, and you can find out information on what that is, and the trigeminal nerve, and then at the bottom, the auricular temporal nerve. And these nerves actually relate to the exodermal tissue, the mesodermal tissue, and at the lowest part of the ear, the endodermal tissue. And that matches up with all of the organs and this upside down fetus that I had mentioned that Paul G. had discovered. So, so there's this fantastic map that represents everything in our body and mind right on our ears. And so when we look on the ear, we can find these tender points. And a tender point is a call for regulation, that the nerve is somehow inflamed or on fire, not directly inflamed that the nerve is inflamed, but that there is the aspect to which it's being innervated has an issue and will benefit from regulation. Just as you get the benefit from foot reflexology in a massage or hand reflexology, the stimulation can assist in regulating that issue, but much more precisely, because we're hitting it with a pinpoint exactly on the nerve of exactly that part. That's why I was showing you that even the spine is broken out into the vertebra, the ligaments, the sympathetic trunk, the ganglia, etc. And it's just like, like a machine has those parts drawings, and it's like an exploded diagram, right?
Yes.
It's almost how the spine then explodes down the antihelical wall of the ear. And so I'm presenting a lot of information, and I invite anyone to go on to Integrate Auricular and follow or take the ear point guide course. And there we show all of these organ systems and functional points and how everything is mapped on the ear.
And do you have specific protocols for ear massage? Because I imagine the ear's not very big. You can massage your ear in 10 seconds and cover everything.
In fact, yeah,
what do you recommend for people who want to activate their whole system through ear massage?
I mean, if we're just talking in very general self-help terms, right? Dr. Nogier would in fact even start with every patient just massaging their ear, their entire ear. It would allow him a way to connect with patients, for one. This kind of human touch is missing completely in our healthcare system today.
Sure.
And the idea that, and this is something that we're working with nurses right now, because it's something that's missing in healthcare, is a connection with the patient. Patients come in, they're traumatized, they're dysregulated, you can't talk to them, and we're not touching them, we're not humanly connecting with them, and we're sitting behind a computer and taking their symptom picture, etc.
Exactly.
We all know that story. Now imagine someone actually comes and listens and touches your ear and finds something that hurts and says, I have a way to help you, and and tell me, have you experienced a lot of, I don't know, back issues, or have you had a lot of anxiety and worry? I can see that those points are sensitive, and we can help to regulate these points. And of course, this is just the tip of the iceberg, right? But on our YouTube channel, you will find the beginning of some self-help and stimulation exercises. I can provide a link to that.
Yeah, please
But
do.
the
I
YouTube
think
channel
people
is
would
just
be
at
most
integrate
interested.
at integrate auricular is the YouTube handle, at integrate auricular. And so to answer your question, yes, for self-help, of course, we could, or it's helpful to, massage the ear on a daily basis, and you can see, oh, the sensitive points. And I would even say, to put out a challenge, you can take a photo of your ear. Take a photo of your ear today, and take a photo of your ear in a year from today, and see if there are any changes. Because what is happening in your body is reflected on your ear. But this is also histological changes. So we're in connection with doctors in China working at the Foshan Hospital for TCM, and their Dr. Liu did research on the histology of rabbit ears and with stomach ulcers. And the point for the stomach ulcer, when that point is surgically explored, the histology, when that point on the rabbit's ear was active and they had a stomach ulcer, actually the histology of the tissue in the ear was changed from that of a rabbit without the stomach ulcer. So our ears are changing based on what is going on in our bodies. And I see this on patients with tremendous amounts of stress and trauma in their lumbar spine, but then emotional stress associated with it on their governor vessel. We can see tears on the back of the ear, on the posterior ear, tears starting in the skin. But that doesn't mean it's permanent. Those tears will then heal. So look at your ear, take photos of it, and listen. And you were introducing us the mysteries of the ear. It's not really the mysteries of the ear, because we're just talking about the science of innervation of the ear. So it's nothing mysterious, but it made me think of the word auricle, and that an ear is an auricle, but the other spelling of oracle, right?
Yeah.
To a broader understanding. So then, I hope that answered the question a little bit about self-help.
Yeah, keep going. Keep going.
And now I'll go into what deeper, at least in German auricular medicine, how this medicine gets much deeper than a 5-point protocol that's done internationally, in addiction centers and such. But doctors in Germany, what they've done is they have taken the development of Paul Nogier. He found, or let's say he developed, because it was actually a woman who discovered this pulse palpation. It was a nurse of a neurosurgeon whose patient, she was holding the wrist, and she could sense that there was a change in the vessel. But it wasn't, we're not talking about a change in the heart rate. We're talking about a shift in a standing wave, okay? So she wondered what this was, and told the surgeon, when I do this to the patient, I feel this pulse shift. And he said, that's kind of interesting, but he never researched it. And it wasn't until a few decades later, Paul Nogier found this note by this surgeon. And that's why her history is completely lost, that she actually found this. But Paul Nogier is known as the developer of the vascular autonomic signal. This is a pulse palpation whereby we can palpate when we bring stimuli into the field of a patient, and these can be frequencies of any kind. For the most part, Germans are using homeopathic frequencies, because homeopathics, like Bach flowers and such, we know are not so much as the herbal component of the flower as they are the information that's contained in that essence, right? And this information is energetic, right? And I'm sure your audience understands this and sees the potential for energy medicine, right? And that all the medicine in the future, well, a lot of medicine in the future will be frequency-based medicine. So what the Germans are doing is using all of these homeopathic frequencies, and they've matched them up with specific pathologies. They found that there's a resonance between certain frequencies and certain pathologies. So when you bring an ampule of a certain flower essence to the ear, you can find the resonance at the location of the pathology in order to say that that pathology has to do with this aspect of the nervous system. They have a protocol for taking the highest 5 priority foci, and foci are blockages to healing. This is what these medical doctors have found as blockages to healing. The whole idea in auricular medicine is that our nervous system is constantly working to provide homeostasis to the body. So when we have a trauma, it's healing. However, sometimes the nervous system goes awry. And even though we may have healed from a scar or a trauma, the nervous system continues to fire. And we know this from phantom pain, and we know this from other neuroscientific understanding, that neural pathways will start to create. And the more they fire together, they wire together, but it might not be helpful to the body. And so the body has created a new homeostasis. However, it might not be the healthiest. In patients who have complex chronic conditions, which sometimes may be termed as untreatable or therapy resistant, in these patients, auricular medicine is a fantastic means to get at the therapy resistance. But because we can find where those neural blockages are, the 5 priorities, we can prioritize the neural blockages, and one by one, we can release the nervous system from those pathways, from those blockages. And then the body is actually in a position for healing. So a story I'll share with you from just one example from one of our lead practitioners at the Canadian Institute of Auricular Medicine, Dave Mabey. He was working with a fisherman who had tremendous chronic pain and was going to lose his job. He couldn't do his work. And he did all kinds of pain therapy, cortisone shots, pharmaceuticals. Nothing was working. So when people don't know what's working, they scour the internet, and then they come across Integrate Auricular, the Canadian Institute of Auricular Medicine, things like that. And so he went to Dave Mabey. And as a practitioner, Dave just unblocked the 5 priorities. It didn't solve the pain. But then when that patient went back to get the 100th cortisone shot, it worked. Because the body was ready to receive it. The body wasn't wasting all of its neural energy on all the wrong pathways. there's only so much energy that we have, right? And acupuncture actually can only move energy, right? We move qi. With lasers, we can add energy. We can actually add energy with laser. And so in Germany, in auricular medicine, they are now not only using homeopathic frequencies, they're able to then dial those frequencies into lasers and apply the laser to the tissue, and the energy is actually changing the ATP production and everything else. So the depth of this medicine goes really deep, and the approaches. And what I was doing in the beginning was just to try and show that there is an organization that relates to your body, just like a microsystem, any other microsystem. But the ear is a much more powerful microsystem because of the innervation. So the reflexology of the hands, it's just not, doesn't have all of those nerve bundles. Those are the nerves of the hand. But those nerves are not like cranial nerves and the entire nervous system of the central nervous system, right? The one that's doing all of the regulation of the body. And that's what's innervating in the ear, and we can stimulate. So at the most scientific end now, neuroscience has caught up to the work of Paul Nogier. Although many neuroscientists, and I've spoken with them, they don't even know the name Paul Nogier. So you wonder, okay, but it shows that independently throughout the world, and we were joking about this before our call, that we have similar ideas, and we're working on similar advances that are connecting to wisdom that has always existed. And the more we connect, we start to build these connections. And once we see the connections, it's wonderful. You know, as I've studied molecular biology and taken physiology classes, etc., it doesn't further me from acupuncture. It actually brings me closer to acupuncture and closer to spirituality and closer to all of these ideas because they overlap. The more we study, the more we find that everything overlaps. And unfortunately, we have to continue with this belief in a time when everybody wants to find the differences. So I always see the ear as a wonderful bridge, and integrate auricular, the mission is to bridge between modalities and to bring together many different areas of practice that can be supported by this work. So auricular medicine in Germany, if you wanted to study it, you'd have to be a medical doctor in order to study auricular medicine and then practice auricular acupuncture. In the States, to practice acupuncture, we have to go to an acupuncture school. It's a 4-year degree, but you don't have to be a medical doctor to start that degree. Auricular medicine, the stimulation of the ear can be via needles. However, we can stimulate with ear seeds. So at the Canadian Institute of Auricular Medicine, oh, sorry, I can't hear you.
What are ear seeds?
Ear seeds are little beads, and they can be made from different materials, natural materials, or they can be magnets, and they're put on as a kind of like a way to provide acupressure.
Acupressure, yeah. So
Without touching.
it's
So
acupressure
it's a
technique in the ears.
exactly, it's a non-invasive, but it's a tiny little bead because you do need to get precise, right, to the point. And so what I was saying is that the schools with which I work, we don't believe that the medicine should be just for medical doctors, right?
Oh,
it should be, whether you're a Reiki practitioner or a physician, you can use this, and it's understood you need to use the methods within your scope of practice. So a Reiki practitioner is going to use the ideas in auricular, let's just say methods, because it might not be specifically auricular medicine. It might be some forms of auriculotherapy and ear acupuncture, and use these methods in a way that makes sense for Reiki, right? They might learn just the vascular autonomic signal palpation in order to understand the autonomic responses of their clients with stimuli, and thereby have a better connection with their clients. And maybe that is meaningful to a Reiki practitioner, and they'll find a way to bring it into their scope of practice. Whereas a physician is looking at the clinical trials that are being done in neuroscientific research on vagus nerve stimulation. And if we stimulate that with a medical FDA-approved device, or through nurses who have been trained medically to deliver in order to treat symptoms that are proven can be treated, right? Then that's the scope of practice, right? And we seek the health care that we need. And I believe truly in an integrated health care system. Right?
Let me ask you this, Duvan. It's a question from Cynthia Bledsoe that many of our group would be interested in, given the fact that in 20 minutes we're going to start a course on remote viewing for extraterrestrial contact and communication. Is there anything in the ear, any point in the ear that enhances telepathic abilities?
I don't know, but Stan Poker has mentioned this before our call, right? He asked, is there something that the ear is with intuitive connections and such? And I would say we should explore this, right? I don't know that connection, but from everything that I've worked with the ear, it is not far-fetched at all to think that our body is reflecting certain things on the ear that we might intuitively be connecting with. So explore, listen to your body. And the ear is one way, and we're not listening with the audio part of our ear. That's the irony in this case. But we're using our ear. We have the ear in order to actually have a window to our brain and listen to ourselves. And you will find connections that might astound you.
Well, it's so interesting that hearing is the first sense to really be developed in utero, as I understand it. And it's the last sense to go at death. So there's something profoundly important in terms of our origination and our passage to other dimensions that's governed or animated in some way by hearing.
Well, that's interesting that you mentioned that, because when I was talking about the germal layers and the innervation, that the innervation of the ear and its matching to the germal layers, and that all is from the embryonic stage, when the spinal column starts to develop and those germal tissue layers are coming out. That is what's on the ear, and that this part of your body reflects all three germal layers, ectoderm, mesoderm, and endoderm, on the ear, right? That doesn't happen on our hand, is fascinating.
It happens on our hand.
Well, I'm not a hand specialist.
But it doesn't happen. That's amazing.
But it has to do with the innervation, right?
Yeah. Yeah. Well, this is absolutely fascinating. I'd never really taken this in. I'm doing a course. I'm doing a lecture on in our great books course on the secret of the golden flower, this very ancient Chinese text that talks about the meditation of the circulation of the light. And it says in the meditative process, as you're circulating the light, the eye goes inward
Mm.
and the ear goes outward. And it's the eye-ear equilibrium that establishes harmony in all things. And
Mm.
I just passed over it when I was preparing Duvan, because I didn't really understand it. I thought, well, the eye and the ear, that's kind of weird. But now that I've heard you, I realize that that's actually a very profound observation to make.
Yes, yes. Well, and so, you know, what's so fun in the discourse of everything that we do, and I say we collegially because I'm not doing what you do, right? And I'm not in the space of
Well, and vice versa.
a lot of what the Ubiquity University is teaching, which are amazing, wonderful things connecting us to wisdom that we have lost. Um, but what I want to say is, even as I'm working, right, that we enjoy and find these connections, but we don't fall into a state where we're finding connections in everything, right? So that we're always trying to bridge what,
Exactly.
what we
Yeah,
intuit and the
exactly.
wisdom that's being given us, as
Exactly.
well as scientific observation, and that we don't fall into the extremes of either or the other. And
Exactly.
that's the problem with society today, is that we
Totally.
we either see patterns in everything, and then everybody's an expert on everything, and
Yeah,
everything is fact, and
exactly.
that's a dangerous path.
Yeah.
And on the other end, one extreme and the other extreme just fighting instead of
Yeah.
seeing where the
Totally.
overlaps are.
Totally. Totally. It's
So
all about integral medicine. Well,
exactly.
Duvan, thank you so, so much. This has been brilliant, and I'm just dazzled. I've rediscovered my ears. So thank you. And we want to have you back when we have a more leisurely and spacious time. But Duvan's going to join the after chat.
Yep.
You'll see the link in your chat box, and you
Okay.
receive the link in your Zoom reminder for today, everyone. But understanding the ear is the portal to the brain, and a very deeply relevant and central organ for our whole body and well-being, is a discovery that at any age is worth making. And
Well,
Duvan Hoffmann knows about as much about this as anybody out there. So thank you, Duvan.
Jim, I want to thank you very much for your work. It is so important, and I thank you for your kind spirit.
Thank you, Duvan. See you in the after chat. Bye.
Oh,